What's up guys, Jade, Rainbolt, Doctor of Physical Therapy here, and today I'm going over plantar fasciitis. Your plantar fascia is a thick tissue that makes up your arch. So this runs from our heel to the ball of our foot. What happens with plantar fasciitis is a lot of times we are increasing the amount of activity. So this can be from if you work a job where you're on your feet all the time. It can be from increasing the amount of walking or running that you're doing. Typically you'll have pain in the heel of the foot, but you may also get tenderness and tightness throughout the arch of your foot. This pain may be present with the first steps upon getting out of bed. You may also have pain with prolonged standing, or you may get pain after sitting for a longer period of time and then going into standing. Typically, as your body starts to warm up, then the pain in the arch of your foot and the heel of your foot tends to go down. So there are a handful of things that you can do, aside from the exercises that I'm about to show you, that can help prevent or decrease the chances of plantar fasciitis from developing or help with the symptoms that you're already experiencing. These things can be arch support in your shoes, regularly changing out your shoes before they get worn down. If you're someone that stands on your feet all day at work, you can stand on a thick cushiony pad. You can also maintain a healthy body weight because the more load that we have up here is going to put more load on the tissues down here. So if you guys find this video helpful, make sure to give it a like and let's get into it. We want to work on strengthening the muscles that make up the foot, as well as stretching the tissues that are tight running underneath your foot. We're going to be doing some toe crunches, and what you're going to do is place your feet flat on the ground and you're going to curl your toes. So these are toe curls, toe crunches. There's multiple names for all sorts of exercises. And then you're going to curl like that. And you're going to feel this into the arch of your foot as you're doing it. But I would do 10 to 20 of these, and you can do a couple sets of them. And these are the toe crunches. Okay. The next one is going to be a calf stretch. So a lot of times the calf and the big toe are tight and they run with that fascia, which can cause it to get tight feeling. So there are a couple different ways that you can stretch your calves, but this is a good one. So you're gonna put the involved leg in the back, and you want your foot facing straight forward. We don't want the foot turned out like that. We want it straight forward, and then you're going to bend forward, and you're gonna feel a pull through your calf. And if you want that to be a little bit stronger, think about tightening your quad to straighten that knee, and that can make that calf stretch a little bit stronger. Some people like to do it even up against the wall. You can do it like that and lean into the wall. But whichever way you feel it into your calf more, just make sure your foot is pointing forwards. And with this one, you're gonna hold it for 30 seconds. So you need to hold stretches for at least 30 seconds for the tissue to actually elongate. Otherwise, it's gonna go right back to where it was. Okay, just like that, okay? And then going from there, we'll go into a great toe stretch. And for this, you're gonna get in the same positioning where your foot is facing forward. And you're going to kneel down, and you're gonna feel that pull through your big toe and possibly through your arch as well. But just like this, you're gonna, just like the calf stretch, you're gonna hold this for 30 seconds as well. And you can do this a couple times. You just hang out, and then you can relax. The next one, you're gonna grab a towel and you're going to put it on, so kind of roll it up, and you're gonna put it on the ground, and you're gonna put your toes on top of it, and then you're going to go into a calf raise, like this. By adding your toes into it, up like that, there's something called the windlass mechanism in your foot that helps with controlling the arch. So you're gonna do calf raises with your toes on the towel. And I would do 10 to 20, depending how it feels. And to progress this, you can even go onto 1 foot, but I would master 2 feet before you go into the 1 foot. The next one's gonna be resisted inversion with a band. So you're gonna hook a band around your foot, and then your other foot is going to stand, step on the other end, like that. You raise your leg up, and and then you're gonna resist your ankle going up into inversion. So this helps with arch strength and just support your arch, which in turn will help decrease load on that plantar fascia. Whew. The next one is gonna be if you're someone who's having this pain that's staying with you. So if you're actively inflamed, you can do an ice massage. So fill up a water bottle, or just grab a water bottle because you're already filled, throw it in the freezer, and you're gonna use this as your ice massage. And you're gonna put it down on the ground, and you're going to roll. Oh, it's very cold. But then you're gonna roll, you kind of get used to it, your foot over it. So you can run all throughout the plantar fascia. This just helps, the hardness of it helps break up stiffness, tightness, and the ice helps with the inflammation. So you can go onto your heel a little bit, and you're gonna roll it all over the bottom of your foot. So you can do this, I would say you can do this for up to 10 minutes, but typically 5 minutes is fine. 5-10 minutes. 5-10 minutes. And that just helps decrease the pain and inflammation. So there you have it. Thank you guys for tuning in, and I'll see you in the next video.